Namaskar and welcome to this edition of Doctor's Chat. I'm Sakal Bhatt, and today our pertinent focus is going to be the lessons learned from the first two COVID waves. And as we prepare ahead as far as the anticipated third wave is concerned, and talking about the anticipated third wave, there's a lot of buzz about third wave wherein children most likely might get impacted. And to have more clarity as to what is expected, the kind of circumstances looking ahead we're going to deal with, decoding pandemic, its various aspects. On Doctor's Chat, our special series on COVID-19. In this edition, we are joined by Dr. Randeep Guleria, Director, AIIMS. Thank you very much, Dr. Guleria, for taking out time again for this interview. Well, this is going to be a very candid and heart-to-heart chat between us, because there is so much of analysis that has gone down the wire about the second wave, the intensity of second wave, so on and so forth. Let me begin by asking you, what are the learnings of the first two waves, particularly the second COVID wave? And as we prepare for this anticipated third wave, are we looking at leaving the worst behind?
So I think we are looking at leaving the worst behind. But I do also agree that we need to really learn from what happened in the first and second wave and not make the same mistakes. So I think the most important thing for us to understand is that the virus is still around and the virus is mutating and new variants are developing, which have the capacity to become more infectious. So to prevent the spread of the virus, COVID-appropriate behavior becomes more and more important, because no matter what be the new variant, if we are able to wear our mask properly, if we maintain physical distancing, if we wash our hands, then the virus will not spread from one person to the other. Remember, it's a human-to-human spread. So the virus needs close contact with humans to spread. If we don't allow that close contact to happen, the virus cannot spread. Secondly, we need to make sure that we don't allow super spreading events to happen. So avoid crowds, don't let crowds form, don't have functions where you can have a lot of people coming in, and continue to have COVID appropriate behavior. And also we need to keep pushing for the vaccine. If we do that, I'm sure we will be able to manage subsequent waves if they come, and may even be able to avoid subsequent waves if we are able to do that. So the learnings from the previous two waves has been that two or three things. One is, of course, we need to focus on health infrastructure so that we are able to manage any surge. But I think more importantly, to prevent such a surge from happening, and that is by COVID appropriate behavior, avoiding crowds, and also having aggressive surveillance, so that if there is an increase in cases somewhere, we can develop that into a containment zone.
You talked about aggressive surveillance. Now, from that aggressive vaccination, eventually, do you think, Dr. Guleria, will lead to, or perhaps reduce the intensity of the third wave onslaught? First of all, what is the probability of third wave? Is there any data or a method to that pattern available? And if we manage to cover maximum under vaccination, are we looking at diffusing the intensity of the third wave, looking at what happened to us, to the nation in the second wave itself?
So yes, so there are two things. We know that viruses, especially respiratory viral infections, do come in waves. And this is, we've seen that they also have some seasonality. COVID hasn't developed a seasonality, but the other respiratory virus, which caused a pandemic about 9-10 years ago, swine flu, also has a seasonality. It tends to have come more in the monsoon months and the winter months. COVID-19 hasn't developed that, but yes, respiratory viruses do have waves, and this has happened in the past also, both during H1N1 and during the Spanish flu pandemic in 1918. Now, the issue to remember is, why does this happen? And that is what we need to do to prevent subsequent waves if we have to really be aggressive. It happens because there is a fall in our own guard. We become more liberal and we feel now we're all right, and the virus is still around. So we have a big wave, it comes down, cases really come down, but there is a susceptible population still amongst us. We then suddenly allow the virus to spread by really becoming more social, if I may put it that way. We are social, and therefore being more social, because we've been sort of restrained for so many months, we start having parties, we start going out, we go out for dinner, we start having functions. And the virus is looking for such an opportunity to spread again into the susceptible population.
You
So
know, you
one,
can't shut down the country, you can't shut down the schools unprecedentedly. Now, having said that, there is a lot of buzz about third wave affecting children. But I want to ask you, and you've spoken and written extensively about it, Dr. Guleria. I want to ask you, is there any scientific evidence, globally or domestically, if we have some sort of empirical evidence that this is actually going to first affect our kids, because host naturally has the tendency, the virus naturally has the tendency to look for the new host?
so there is no scientific basis to say that COVID children will now have more severe disease. Let's look at it from the point of view of what we've seen in the first wave, the second wave, and what we're seeing across the world. What we're seeing is that children have a mild disease globally, and even we saw that in the first and second wave, that they do get COVID infection. It's not that they are protected from COVID, they will get COVID infection, but they, because of the fact that they have less what we call ACE receptors in the lungs, in the upper airways, the virus is not able to multiply that much in children, and therefore they don't get that severe a disease. That's why it seems that although children may be a susceptible population and they may get COVID subsequently, they will not get severe disease and we will not have that type of a problem. And that is why the focus still is on protecting the high risk group, which is elderly and those with comorbidities. And we still should focus aggressively on vaccinating them first. The data from the second wave and from the first wave clearly shows that the mortality was highest in the older age group and those with comorbidities.
In the second wave also, you're
In the
talking about the
second
second
wave
wave.
also. Yes, in the second wave also. In children, if you look at it, those who had severe COVID were only those who had comorbidity. Those who had underlying illnesses like had cancer and were on chemotherapy or had other comorbidities which caused them to have a severe disease. Healthy children did very well, and I see no reason why that should change in the coming months.
So you're saying that whatever data is available suggests that if healthy children do get infected, the intensity will be less. So there is no alarm, there's no panic, right?
Correct. On the other hand, I'd also say that since there is this huge concern, it's always better to be prepared. But I don't think there's enough data to suggest that we should really go into a panic mode. We should
Panic
prepare,
mode.
but we should not really suddenly start really getting panicky. That is not going to happen.
Yes. Now, since we're talking about children now, like I asked you, you cannot shut schools unprecedentedly. That is not the solution. It is just a stopgap arrangement. Even the online classes, then that comes with different sort of consequences. It's not a long-term solution. So in that space, Dr. Guleria, what is the task force suggesting? What are the suggestions? I'm specifically talking about school-going children.
So I don't think there's any conclusion that is there. I can just give you my opinion, and that I think is basically looking at two or three factors. One is I totally agree with you that we cannot shut down schools forever, and this is really having a big problem in children's education, in their overall development, in their career growth, and also especially children who are marginalized or the low socioeconomic status are suffering because they may not have the facility to do all the online classes that we are looking at right now. And therefore, physical schools in the form of teaching, in the form of social development, and in the form of making sure the children are sort of outside the house and are able to develop themselves, and at the same time looking at nutrition and other things becomes very, very important. Now, the issue is how do we balance the chance of children getting infection versus these schools that we need to open up? We need to look at different models which have been looked at even globally, which look at either developing a strategy there where you screen and test all the children when they come in, or you could have half the school opening on one day and the other half on the other day, so that only 50% of the children come and therefore they can be more physical distancing and less crowding, or other mechanisms can be looked at. Even testing has been looked at in certain colleges. So we need to develop strategies where we continue to have close monitoring, surveillance in that area, and at the same time have limited opening up of schools so that schools are also open, but we don't allow the infection to really spread in that area. So there are solutions that can be worked out, but I do agree that we cannot indefinitely go on with schools being shut.
Yes, and that is not a solution. So by year end, if all goes under control, first of all, before I ask you the anticipated third wave hitting us by year end, let's first talk about Dr. Guleria, your assessment. Uh, as far as let's not get into numbers and the rate and the graph keeps changing as we speak, but overall assessment. Uh, the situation prima facie, it seems, Dr. Guleria, has eased out a bit, but that doesn't mean that we have put virus to rest.
Correct. So this is exactly what I'm saying. The situation is easing out. Cases are coming down. We're coming to a downward trend. And there are certain states which are still showing high case numbers, but overall as a nation, we are showing a downward trend. The challenge is that once we have a downward trend, we should not have any complacency. We should not feel that now things are back to normal and we start really going back to non sort of COVID appropriate behavior, because that is exactly what the virus is looking for. So all the gains that we've had over the last few weeks or the last 1 year go to waste when suddenly we throw everything outside the window.
So are you, to put it mildly and lightly, now are you saying that this is the life we have to get used to, Dr. Guleria? There are going to be restrictions and this is the new normal. This is the new normal, but my question to you is, how long is this new normal going to stay?
Correct. So the issue is, this is the new normal for the time being. It's not the new normal forever. That's one. So we have to be a little bit more patient. And the other thing is, once we have a large number of our population vaccinated, 50-60% of people are vaccinated, we will be able to break the chain of transmission and we will be able to prevent the virus from spreading from one person to the other. And that will actually allow us to open up more liberally. So we need to wait for a few more months, 5 to 6 months. We will have a huge number of vaccine doses given to our country. And once we're able to do that, a large number of people will be protected. They will not allow the virus to spread from one person to the other. And that will give us good amount of protection. And then we could really lower our guard a little bit, but not before that, because otherwise we will continue to see new waves happening.
New waves happening. Have we restricted the virus so far? Have we broken its backbone so far in this period, the juncture, what we saw in April, then May, and now we're getting into June, July?
So we have decreased the number of cases. So the virus replication has come down. But let's look at it from the virus point of view. The virus is trying to survive. And to survive, it has to do two things. It has to find a host in which it can survive. So virus is looking for an opportunity to spread to susceptible people. And once we let our guard down, we allow the virus to do that. Secondly, the virus also is trying to survive by mutating. So we have to factor that in. The virus will undergo some degree of mutation, and that is something that we need to also keep in mind, because there is going to be some degree of variants which will develop, and we should be ahead of the virus and take that into account as we go along in our management strategy.
You have this point. I was coming to that question, sir. The new variant. What is this new variant we are looking at? Has it emerged? Will it emerge? And then are we looking at vaccination strategy, process, combination, everything changing accordingly?
So this is a developing science and we are just learning about the virus. But 2 or 3 things I'd like to say. One is viruses like the coronavirus or the influenza virus are known to mutate. They will go on to mutate. There may be some variants which will develop because of mutation, which are variants of interest, but there are others which will be variants of concern. And when we talk of variants of concern, we are looking at 3 or 4 things. One is, has this variant become more infectious? Is it spreading much more? And this is what we saw with the variant known as the Delta variant, which is spread rapidly in our country and caused this huge spike that we saw. The second thing that we look at is the virus becoming now more virulent. Has the variant causing more severe disease? We're having more hospital admissions. And the third thing is we're looking at is, has the variant developed immune escape mechanism? Is it causing more reinfection, or is it now causing the vaccines to be less effective?
Yes.
Currently, the variants that we have, that we've seen, suggest that they are more infectious, they're spreading more rapidly, but they are still not causing the vaccine to become less effective. They are decreasing the antibody production, but the vaccines are still working. Therefore, if we roll out our vaccine more aggressively, we will have to really, we will be able to protect the vulnerable population and not allow the virus to spread. But having said that, we have to keep looking at the virus and looking at new variants, and if need be, keep changing the vaccine or looking at different vaccine strategies so that we are able to protect people more and more.
So let me put it this way. You're saying, Dr. Guleria, that new variants, there's no need to be feared of. The new variants, even if they emerge, they don't have any impact as far as the efficacy of vaccine is concerned, right?
The current existing variants, new
Current
variants, we
existing.
don't know how they will develop.
So we will, and new variants as they develop, if they develop, our vaccines will be modified accordingly.
Yes, the vaccines can be tweaked and modified, and we do that every year for the influenza vaccine. A new influenza vaccine comes out every year based on the new mutations which happen. So we may do that. We have another advantage. This is the first time that for one virus, we have so many vaccines. We have Covaxin, we have Covishield, we have Sputnik, we have Pfizer, we have Moderna, and there's so many others. The DNA vaccine by Zydus is there. We'll have the VLP vaccines. So there may be a possibility that as we do
You've
more
also
research,
suggested, I'm sorry I'm interrupting you, granting indemnity to Pfizer and Moderna. You've been talking about that as well. Do you think that's very, very important, very significant?
so I think it's something that we need to look at because we need to get as many vaccines as we can for our own country. We are a very large country, our population is very large, and therefore if we can have a strategy which allows more vaccines to come in for our own citizens, I think we should be liberal in that because we need to get more and more shots into the arms of our own people, and that's what we need to do.
Uh, I was just reading, Dr. Guleria, one of your research papers where you've, uh, it's a sort of study on your study on the respiratory outbreaks of respiratory viruses and its correlation, increase in cases, how it really converts into wave and all. Dr. Guleria, just to simplify it further for the nation, viewers of national broadcaster DD News, it's been an year-long situation, and there is a lot of data available. There is some pattern to it. Looking ahead, looking at the anticipated third wave, what would be your message to the nation, Dr. Guleria? And to that, I want to quickly add, when will we actually see the normal life restoring? When is going to be normalcy returning, coming back home?
So the first thing that I'd like to say is that it's been a year, it's been a big struggle. A lot of people have lost their lives and livelihood. And at the same time, we have shown a lot of resilience. The country has come together and fought this pandemic in many ways, in terms of PPEs, in terms of N95 and other things. And therefore, I'm very confident that if we work as a team, we will come out of this pandemic. The thing that I would say is don't take the virus lightly. Continue to have COVID appropriate behavior. Continue to wear your mask. And when your turn comes, please get yourself vaccinated. If we do this, we will prevent further waves from coming and we will be able to actually come out of this pandemic. When will we come out of the pandemic? That's a tough question. If we are able to vaccinate a good amount of people and we will be able to do that by the end of this year, I think we should be seeing a good way of coming to a better position by the end of the year or early next year. And hopefully next year at some time, we should be able to say that we have really come out of the pandemic. But this is a difficult question. I won't really make a guess.
Okay, I'm not going to leave you that early. There's few more questions left. Lot of spade work. There's a lot of I wouldn't use the word preparation, but a lot needs to be done as we prepare for the third wave. And not even third wave, generally also this pandemic has taught us many lessons, but lot is desired also. Let me first specifically ask about the medical workforce, which many eminent medical experts feel that is the dire need of hour as of now. We need more and more trained nurses and doctors, COVID specific.
Yes, we need in general also, if you look at the number of doctors per thousand, let's say, population, there is definitely a need to have more doctors in our country, more nursing officers, more healthcare workers. And that's even much more for rural India. We have a lot of high density of doctors in, let's say, cities, But as we go to smaller towns and we go to rural India, there is a need to develop a strategy where we can have more doctors there who can provide quality care. We also need to focus on developing infrastructure, good health facilities out there. And I think the pandemic has told us how important it is, not only from the point of view of health, but from the point of view of economy. And I feel that we very often talk of health as a service sector. I think it's not only a service sector, it's a sector which can generate a lot of revenues, because it helps in generating a lot of other additional things. If you have a good functional hospital, it could be a chemist shop, it could be other activities that can be done around it. So I think we should really invest more in health, look at it as a service sector, and look at it from the economic point of view. And we should focus a lot as far as smaller towns and cities are concerned. And of course, like you said, develop a good, robust workforce which can manage routine
You
work, but
see that
also
as
has
a
the
challenge
capacity to
area,
manage.
Dr. Guleria?
I beg your pardon?
Do you see that as a challenge area, major challenge? We're
I,
racing against time, are we?
it is a challenge, but I think we can overcome this challenge. If we put our mind to it and we develop strategies, we can overcome this challenge. It's something which it's not going to happen overnight, but if we make a beginning, then we should be able to do it. And I'm not only looking at it from the pandemic point of view. I'm looking at it from the long-term health infrastructure point of view, because this will be very useful for us in the long run. If we in smaller hospitals, if we put in now what we call PSA plants which generate their own oxygen, the hospitals become self-sufficient for oxygen for even decades to come. And therefore, they will not have to depend on cylinders and things like that. So we should look at solutions which also will benefit the healthcare infrastructure in the long run and be useful even after the pandemic.
Did we not see it coming during the second wave? Uh, in retrospect, and then preparing ahead, you started by saying we've definitely left the worst behind. Very assuring line. Looking ahead, are we now dealing with a known situation, not an unknown situation?
Correct. And I think what we should remember is that it's always difficult to predict how the virus will behave. What really, I suppose, caught the country by surprise was the rate of rise in the number of cases. Everyone predicted a second wave. They thought the cases would rise slowly and we will be able to manage them. But the rate of rise happened because of two things. One is, of course, lack of COVID appropriate behavior, a lot of crowds, but also the emergence of new variants, which became much more infectious. Had we got the older variant, the rate of rise, as we saw in the first wave, was much slower. This was a much steeper curve.
What is the possibility of these new variants emerging as the time goes and as we have more and more vaccines as a protection and not cure?
So new variants will continue to emerge. Let's look at the virus and understand this. We will have variants which will emerge. It's been said that the virus mutates twice every month. Some of these mutations are not of any significance. They are just of variants of interest. But we are concerned about variants of concern, which can, like I said, cause more infection, more severe disease, or decrease the efficacy of the vaccine. That is why we need to continue to monitor the virus and develop strategies based on how the virus is changing. We should change and develop strategies as the virus changes. The virus will continue to change. So what we decide today may not be really
applicable
relevant
tomorrow.
We will have to change our strategy tomorrow.
Finally, Dr. Guleria, how does your COVID solution template, when we talk about decoding pandemic, since we are talking about vaccination and third wave, sir, anticipated third wave, main pointers in that, your list?
So my pointers of what we should do would be, first of all, we need to continue to have very aggressive surveillance. We need to focus on our testing, tracking, treating policy very aggressively. Not only testing and picking up positive cases, but also testing them with genome sequencing in sufficient numbers to pick up any new variants which develop. We should have, based on that surveillance, we should be able to develop containment zone so that we don't allow any spike which happens to spread to other parts of the country. So quickly sort of snub it out there, don't allow it to spread, and do that. Thirdly, we need to develop strategies of aggressive vaccination, try and vaccinate as many people as we can. And of course, aggressively push for COVID appropriate behavior, because that will spread and break the chain of transmission. So if we do all of this, followed by finally, of course, ramping up our health infrastructure so that we have enough capacity to take care of any increase in number of cases which happen. If we do this, I think we should be able to manage subsequent surges if they do occur.
Looking at what we saw in the month of May and April, are we now in the grip of situation? Have we taken under control? Are we
Currently,
under control?
Currently, the situation is much better. We are not in a situation where we were a few weeks ago, where there was really no beds and we were looking at limited oxygen supply. All of that is behind us, and I think we should look ahead, but not forget the lessons from the past and continue to really improve on that and make sure that we don't go through the same type of situation that we've been through a few months ago.
And normalcy will restore, Dr. Guleria, you're saying, but you're not attaching any timeline to it.
I'm sure normalcy will restore, but the only issue is when it happens. A lot depends on the vaccination, how successful it is, and how careful we are in terms of preventing the virus from spreading.
Thank you very much, Dr. Randeep Guleria, Director AIIMS. Such a pleasure talking to you, sir, and for those reassuring lines. Thank you so much for joining us.
Thank you.
And that's all we have for you in this edition of Doctor's Chat. Dr. Guleria there reassuring the nation that aggressive vaccination is one of the very, very important solutions, along with following COVID protocol and COVID appropriate behavior. Well, with that, let's wrap it up, and we'll see you next time. Thanks. Namaskar.
There's a lot at stake at the